Hi guys, my name is Sofia Correa and the topic of the day is cancer in pulmonary nodules detected on first screening CT. The definition. First we're going to define what is a lung nodule. A lung nodule is defined as a spot on the lung which is 3 centimeters in diameter. If it's larger than that, it is called a lung mass.
Hello, I'm Dr. Jasmine Huang, thoracic surgeon at St. Joseph's Hospital Medical Center in Phoenix, Arizona. I'd like to talk with you a little bit today about the pulmonary nodule. First off, what exactly is a solitary pulmonary nodule? Well, technically, it's a finding on imaging studies of the lung of up to 3 centimeters in size on the lung tissue that's usually seen on a chest x-ray or a CT scan of the chest. Usually these findings are in patients who rarely have no symptoms at all, so they're considered incidental findings. So then we have to ask, what is this nodule? Where did it come from? Well, there's a huge differential diagnosis for these nodules. They can be benign or malignant, meaning it could be a cancer. Benign causes can be due to infection or inflammation, from a trauma, or from something we're just born with.
So continuing with the presentation, applications in medicine. As the doctor previously said, there are different type of causes. It can be from an infection, other diseases, or a neoplasm, or including a trauma. Symptoms. Usually, people that suffer from these lung nodules don't suffer from symptoms. They usually live a normal life, but some of them might cause some of the nodules might cause coughing with blood. For the treatment, you can go also from chemotherapy to radiotherapy, or it can be surgical to a lobectomy. So, what is a lobectomy?
The gold standard therapy for resectable lung cancer is a lobectomy. All patients have 5 lobes, 3 on the right and 2 on the left. When we can, we'll remove the entire lobe plus the lymph nodes draining that lobe so that we can adequately treat as well as stage the cancer.
So that means the removal of a lung lobe. For the diagnosis, we have here, this topic is about the first screening CT. What is the first screening CT? It is the screening with the use of a low-dose thoracic CT, which reduces the mortality by 20%. This is an investigation.
This is Jeffrey Drazen for the New England Journal of Medicine. A patient who is a former smoker is enrolled in a low-dose CT lung cancer screening program. A lung nodule is seen on her initial scan. What are the chances that this is a lung cancer? In this article, the investigators used findings from large screening trials to identify factors associated with malignancy on follow-up of nodules first found on low-dose CT screening. They sampled people with at least 30 pack years of current and former smoking, who were between 50 and 75 years of age. If nodules were identified on the low-dose CT scans, nodule size and location in the lung were recorded. Participants were followed with repeat low-dose CTs until all nodules were stable for at least 2 years, resolved, developed benign characteristics, or were found to be either benign or malignant based on biopsy or surgical resection. Data from a first set of patients were validated in a follow-up cohort. In the first cohort, with over 2,500 participants, 7,000 nodules were found. 102 patients had lung cancer. Generally similar data were found in the validation study. But what is the risk that an individual nodule is cancer? Nodule size was associated with lung cancer in a nonlinear way. 5 millimeter nodules had about a 2 in 1,000 chance of being cancer, while 10 millimeter nodules had a risk of about 2 in 100, and 20 millimeter nodules had a risk of about 1 in 10. A 4-fold increase in nodule diameter was associated with more than a 50-fold increase in cancer risk. Cancers were more commonly observed in the upper lobes. Nodule counts were lower when cancer was present. And a key finding was that in over 4,000 patients in both cohorts, not a single periphyseal nodule turned turned out to be cancer.
So that means the bigger the nodule is, the higher the risk of having lung cancer. So these are the pros of pulmonary nodule cancer. 50% of the nodules are benign. That means they're good. They're not caused by cancer. It is also very easily detected by CT, and the chemotherapy ensures that all cancer cells are gone, so no more cancer. This is about living with lung cancer chemotherapy.
Covers the treatment of cancer with drugs, and more than likely will use a combination of drugs depending on your lung cancer. Chemotherapy is administered in treatment cycles lasting 3 to 4 weeks. The number of cycles you receive will ultimately depend on the type of lung cancer you have and how well it responds to the treatment. Chemotherapy works on cells throughout the body, but while it targets cancerous cells, it can also kill healthy ones. As the healthy cells repair, there may be side effects, so between each treatment, there will be rest periods, creating a cycle of therapy. Before each and every treatment, you'll have your weight monitored and a blood test to check that your blood count has recovered enough to cope with the treatment. You might also be asked to have another chest X-ray or CT scan after a few cycles of treatment to see in more detail how the tumor is responding. The total number of cycles of chemotherapy you receive may be influenced by the results of these scans.
So make sure you follow up with the sporadic checks to make sure how your lungs are developing and if it's affecting normal cells. The cons of having pulmonary nodule cancer: patients might not quit smoking. As we all know, you can help someone that doesn't want to be helped. And the cost of chemotherapy is pretty high. And also, as we know, the side effects of chemotherapy.
Excuse me, handbrake needs your attention.
Oftentimes, patients under treatment for lung cancer are concerned about the effects their therapy may have on their body, and this is entirely appropriate. Patients who receive chemotherapy for lung cancer can expect that there may be damage done to other organs. The most common is the blood organ or the bone marrow, and that is because the chemotherapy arrests the growth of those cells, which may cause anemia, which is a low red blood count and can cause weakness and fatigue, or low white cell counts, which can predispose a person to infection, or low platelet counts, which may predispose to bleeding. For that reason, during the course of treatment, your doctor will be monitoring your blood counts and likely adjusting your chemotherapy should there be major abnormalities that develop.
So here are more reasons to not miss the sporadic checks. And related disease of rheumatoid arthritis. This disease is primarily affecting joints, but it sometimes causes lung diseases as well, such as scarring, lung nodules, and pleural diseases. A little bit about this disease.
These are the hands of rheumatoid arthritis, and they belong to Regina Hamilton. She's had the joint-destroying disease for 30 years.
I actually had these metacarpal joints replaced with artificial joints, and I also had a screw placed in my thumb.
Rheumatoid arthritis, or RA, affects at least 1.3 million Americans, women more frequently than men. It's considered an autoimmune disorder, meaning the body, for unknown reasons, begins to attack its own joints. In this way, RA completely differs from what many might consider the classic arthritis of older age, osteoarthritis.
Osteoarthritis is what we typically think of as sort of wear and tear type arthritis. Rheumatoid arthritis is an inflammatory joint disease that affects typically smaller joints. We're pushing in the wrist joint itself, looking for swelling or tenderness.
That would include, most especially, joints in the hands and, very commonly, in the feet.
Patients will say that they wake up and they're very, very stiff, and that stiffness lasts for a half an hour, maybe an hour or longer. Until they get in the shower, they sort of limber up over time and then start to feel a little bit better.
That stiffness indicates an inflammatory process that can lead to joint destruction. But rheumatoid arthritis is not just a joint disease. The inflammation can affect other body parts as well, most importantly, the heart.
The link between the cardiovascular component and the inflammatory component is getting stronger and stronger. And the cardiovascular mortality is a major part of the mortality associated with.
Thank you very much.